Ah, iron infusions for restless leg syndrome. Doctors don't seem to know about them. Hard to get. Who's going to pay for them? Why not just take an oral iron supplement? It's pretty much cheap if you go down to the pharmacy. I'm Dr. Andy Burkowski of ReLACS Health, and today I want to discuss the difference between oral iron supplements and IV iron infusions. There are huge differences. Both can be good treatments for restless leg syndrome, but let's get into the major differences. So, with oral iron supplements, you're basically eating the iron, it's going into your gastrointestinal system. So, therefore, there's sort of a nightclub bouncer or a gatekeeper in your bowels that prevents iron from getting into your bloodstream. You want the iron to get into your bloodstream and hopefully into your brain to help with restless leg syndrome. But that gatekeeper is in there. So even if you take higher and higher doses of supplements, you're not going to get more iron in because there's only so much iron that the gatekeeper will allow into your body. Therefore, most people have to take a low dose of a supplement, perhaps every other night or maybe once a night at most, to get some iron into their system. And it's going to be very, very small amounts of iron, even if it's on an empty stomach. And over the course of weeks and weeks, if not months, those iron levels can go up. But that's only if people's iron levels are low. If people's iron levels are low in their blood, and I've spoken about this in other videos, once you're above a certain level, the nightclub bouncer comes in and says, no more. You cannot get any more iron. Nobody's entering into this club. You cannot get more iron into this club. That could be at a ferritin of 75. It could be at a ferritin level of 100. It could be a ferritin level of 125. But that's the safety mechanism the body has to prevent high iron levels. However, there is no direct correlation with body or blood iron levels with brain iron levels. And in restless leg syndrome, people with higher brain iron levels from an iron infusion might be better off. And why can they have higher iron levels from an IV infusion? Well, if you're going with an IV into the bloodstream, you're getting the iron directly. You're going past the bouncer. So that's sort of like the back door of the nightclub where the owner lets you in the back door. The bouncer's not going to bounce you out of the nightclub because you're taking the back door. So that's what the IV is doing. And it's not just little increments over many weeks or many months. You can get 1,000 milligrams in 20 minutes, and that could give you a year's worth of iron in one setting. It's an incredibly powerful treatment, and now it's become a consensus first-line treatment for restless leg syndrome, even in a lot of individuals who don't quote unquote have low iron levels. People with low normal iron levels may benefit from this iron infusion by driving up the iron levels in the body higher than you could get through food or through supplementation. That could help bring the iron levels up in the brain and help relieve symptoms of restless legs syndrome. So yes, many doctors do not understand iron infusions. It may be hard to find one. It may be hard to get it paid for by an insurance company, or it might be very expensive to pay for out of pocket. But some of these steps are worthwhile in getting that huge dose of iron, which could be extremely beneficial for restless leg syndrome. As always, this video is for general medical informational purposes only. It does not constitute medical advice or medical practice. Make all your decisions about iron or any other health matters with a licensed medical professional. And as always, one of the keys to sleeping well is to relax.